Thank you for tuning in to Uncommon Women. I'm Shanera.
I'm Kate.
And I'm Jenny Lee.
So today we're actually going to be speaking on postpartum depression. We will be sharing what postpartum depression is, some signs and reasons why women are depressed after pregnancy, and ways to cope or help a loved one after delivery to avoid postpartum depression. Some of you may be wondering, well, what is postpartum depression? It's a mental health illness that affects women after giving birth. Anxiety or any suicidal thoughts may last longer than a few weeks. 15% of women experience postpartum depression.
It is linked to chemical, social, and psychological changes associated with having a baby. The chemical changes involved a rapid drop in hormones after delivering. The actual link between this drop and depression is still not clear, but what is known, the levels of estrogen and progesterone, the female reproductive hormones, increase tenfold during pregnancy. Then they drop sharply after delivery. By 3 days after a woman gives birth, the levels of these hormones drop back to what they were before she got pregnant. In addition to these chemical changes, social and psychological changes associated with having a baby create an increased risk of depression.
So let's be honest, ladies, we are women and we do have hormonal changes that happen every day, every month, every cycle. We're emotional creatures. But coming up to a stressor, and not saying that having a child isn't a stress, it is. There's a lot of things you have to take care of when having a child. Research shows that women who suffer from postpartum depression have a hard time regulating their emotions. And people who have a high likelihood of being depressed or like other depressions can suffer from low serotonin or norepinephrine levels in the brain that are imbalanced and also a nutritional deficit. Research by the University of Pittsburg has shown that the role of serotonin regulates moods. Low serotonin levels have been associated with virtually every single type of depression. Serotonin and its neurotransmitters, those are those things in your brain, chiefly made by the adrenaline glands, which is what you feel that rush in when you have a mood swing, or that excitement that comes, or a rush of love, or when something bad happens, you have that sadness that overcomes you. Those are generated in the adrenaline glands. They all work together to stabilize our moods. When a stressor comes in our life, for example, a newborn baby, it increases our adrenaline glands and makes more catecholamines, which in turn causes our brain to have less serotonin to maintain a healthy balance. As stressful events like pregnancy and childbirth occur, the brain can struggle to make enough serotonin to meet the new levels they need to all work together for happiness. Another portion of the brain that is affected with postpartum depression is something that physically happens in the neutral circuits of your brain. I know this might all sound foreign to the majority of our listeners, but in your brain there are panels that emotion attaches to and bounces off. It is uncertain whether these changes are a cause or effect of postpartum depression, but a research in the University of Pittsburgh shows that metabolism in the amygdala was significantly different in women with postpartum depression than those without. The amygdala is part of the limbic system. It's associated with functions related to your memory, any anxiety, fear, or other emotions. So if that's not working, it's going to affect any forces of anxiety and fear and any emotions that your hormones can't grasp up. A dysfunction in the amygdala is implicated in problems such as anxiety disorders, borderline personality disorders, post-traumatic stress disorders. The amygdala is part of a feedback system that releases stress hormones and then has an effect on the sympathetic nervous system and the fight or flight response that some of you might be familiar with. Mothers with postpartum depression showed a little less activity in the amygdala when shown a sad or happy face with those symptoms. And then this research helped show that these problems may have mothers have bonding with their infants, which is part of post-traumatic stress. It indicates that a mother with postpartum depression would not have the same empathetic or protective reaction to a crying infant as a mother without this disorder would. In addition, more activity in another part of the amygdala correlated with hostility towards the infants. Anxiety and fear, a lot of you folks might be common with the disorder of OCD. It's a psychiatric condition characterized by highly distressing thoughts and ritualistic behaviors. Most commonly, you know, the person who's turning the light switch on and off 12 times, or the one who's hand washing, or they're constantly checking on their newborn child. Research has evolved out of Yale University that shows signs of parents who suffer from OCD might have a similar effect in postpartum depression with taking care of their infant. Yes, they may experience levels of elated happiness, but they also have levels of anxiety and distress. As a new parent to, or just a parent to a new child, you suffer a level of stress. You want to make sure you're taking care of them. You want to make sure that they're fed and they're breathing. How many times does that parent wake up in the middle of the night to make sure that the infant is still breathing in their crib? This is all normal, but association with OCD, they're at a higher risk to suffer from postpartum depression. They make things more irrational than what is needed for survival. And it can actually cause an opposite effect, that the mothers can feel that they can't meet the needs of this child, so they become emotionally numb and cannot care or interact with the newborn. They become disoriented and can suffer from a sense of detachment. Mothers are more anxious, and they feel emotionally charged that they cannot inhibit thoughts or impulses concerning the baby's care. These symptoms of depression and anxiety tend to overlap.
Okay, ladies, I do have some factors on postpartum. It's limited support, living alone, mental conflict. If you already have children, age, time of pregnancy, the younger you are, higher the risk. The history of depression prior to becoming pregnant or during. Having a history of depression or PMDD.
I agree. Feeling life isn't worth it. Showing little interest in the baby can be other signs to show that you may be experiencing some depression after pregnancy. Inability to care or want to care for an infant may not occur until several weeks to 6 months after birth. Lost the mist of motherhood. You know, you were so excited about being pregnant and you couldn't wait to feed and change and spend time with the baby, and then once you have the baby, you just feel as though you're not worthy or you're not ready to be a mother. And then you have voices saying that you're not good enough, and the baby keeps crying, and you're trying to figure out, why is the baby crying? You have yourself in situations where you're like, I've changed them, I fed them, and they're still crying. And your feeling is down and depressed, like you're not doing what you're supposed to be doing as being a mother, or you're not a good enough mother like everyone else. Those can be some other signs showing that you may be experiencing some postpartum depression. As for married women, they may lack emotional connection with the intimacy of the loved one. Husband, demanding that they meet needs as well. And then you're also juggling the portion of trying to be a mother as well as a wife to support both the needs of the family. And then we have career women where they're structure driven or task oriented, so that they have issues, completing the task, like cleaning up or cooking or finishing normal routines around the house, and the baby keeps crying every 2 hours. And you're trying to figure out, why can't I complete the task and be a mother? Those could be some signs showing that you may be experiencing some postpartum depressions. Now, don't confuse postpartum depression with baby blues. So baby blues typically are 70 to 80% of women that have babies. It's normal to feel stressed the first couple of days or even overwhelmed after having a baby. For baby blues, it's the same symptoms as postpartum depression, except postpartum depression is typically more severe than baby blues, and baby blues typically lasts about 10 days to 2 weeks.
Also, there is another part of postpartum depression. It's a more severe, longer lasting depression, which is called postpartum psychosis. Psychosis can get to a point where you want to hurt yourself and the baby, and it's real severe and it lasts longer in postpartum depression.
Right. It's commonly actually more severe and increased in people that have bipolar or schizophrenic tendencies. They typically have that type of mental disorder after having a baby. Psychosis can typically occur in women if they don't get treatment that they need, and long-term with postpartum depression.
So basically, ladies, you can go from the baby blues to developing to postpartum depression to the snowball becoming an avalanche into postpartum psychosis. This is a very serious disease. Symptoms of postpartum psychosis could evolve into hurting yourself or even hurting the baby. So let's get some help. How do we treat postpartum depression?
Let's face it, ladies, it's not easy. It's not easy carrying a baby, You also have to think about the things that you're eating while raising and carrying another child. And then after you have the baby, life events may occur. You may have a premature birth or a difficult delivery, even a loss of job or a move, but these issues cannot affect your mental growth with being a mother. So some treatment you may want to consider after having a baby is gathering a support team. It's very important to be able to depend on friends and families, or even a church if you're involved in a church. I know some things that we do at my church for when women have children is the first week after they get home, we gather like a family and we cook a meal for the family or the single parent, or if they're married, a meal each day for the first week, just to relieve some stress in regards to being a new parent and bringing a baby home. Let's not forget about the parents that have several kids and may just want to be well rested. Take the time to actually help someone, or even talk to other people when they have more than one child. Maybe even pick a couple of kids up and see if they want to take a break from being a new mom.
If you're a mom, maybe you have experienced this after you have the baby. Your mom or your mother-in-law or somebody very close to you comes in and stays with you the first week that you have a newborn. They're probably just elated to hold a brand new baby in their home, in their arms, to be in your home, to experience this moment with you, especially a grandparent. They're just so excited. But really, what are they doing? They're your doula, right? Some mothers benefit from the aid of a postpartum doula. It's a helper that comes into the home to assist in both the new mother and the child's health and well-being. It gives that mom that warm and fuzzy feeling that they have the support of a family or friends, that sense of community. It gives them the chance to catch up on sleep, to catch up on chores in the house, to alleviate exhaustion and alleviate the sense of isolation that can help, that actually can worsen the illness. And don't forget to find time to do something for yourself. Remember that you are the same person you were before you had the child and after you have the child, even if it's only for 15 minutes a day. Try reading, exercising, taking a bath, meditating. Don't forget to continue doing the things that you loved prior to the baby.
Yeah, I agree. Hygiene and appearance may not be, important to you, but health-wise, it's definitely important to take care of yourself. Encourage yourself that, even though you are juggling being a mom and taking care of another baby, that you still have to remain in a positive aspect over your life. is very important. Also, try doing some daily activities like keeping a daily diary and writing down your emotions. Try not to reread until you actually feel better, because we don't want any anger or any frustration over yourself to occur when you're in the transition of being a better you in the process of avoiding postpartum depression.
Okay, ladies, postpartum depression can be treated just like any other depression. It can be treated differently depending on the type and how severe the symptoms are. Treatment options are anti-anxiety or antidepressant depression medications, psychotherapy, partake in a support group for emotional support or education. Also, ladies, you can also breastfeed. You can take medication while you are breastfeeding. Talk to your doctor. Many women may feel that they can't take the medication while they're breastfeeding, but you can. But that's a decision that can be spoken between you and your doctor. But in the case for postpartum psychosis, drugs used to treat psychosis can be added. Hospital admission is also often necessary if it comes down to that point where it becomes really bad.
Yeah, I agree. Speak to your doctor. Let your doctor know if you're having any emotional changes or problems in regards to after you're having your baby. Typically, a woman has a checkup about a week after they have the baby. So if you're experiencing anything unusual to your self-being, make sure you're talking to your doctor so they can give you any help or treatment that you may need.
Yeah, there's no stigma behind postpartum depression. There's no stigma behind your feelings. You need to trust the support, the counseling that doctors have. Be open and honest about the way that you're feeling so they best can prescribe what is the best treatment for you, whether it's mild, just the baby blues, or something more severe as psychosis. Feeling depressed doesn't mean that you are a bad person. It does not mean that you did something wrong or you brought this upon yourself. If you have given birth recently and are feeling sad, blue, anxious, irritable, tired, or you had all the symptoms, any symptoms that we had discussed earlier, remember that many women have experienced the same. You're not losing your mind. You're not going crazy. You shouldn't feel that you have to suffer through it. Make sure that you do take some of the tips that we discussed earlier.
I agree. 1 in 7 women can expect or experience depression 1 year following after giving birth. Now, ladies, let's not forget about the men. Men can also experience postpartum depression. Statistics say 8% of fathers experience postpartum depression the first 3 years of being a father, and 10% of fathers can actually experience it further down the road. So, what does postpartum depression really boil down to? It boils down to mind control. Mind control is very important. You have to continue to keep renewing your mind and reminding yourself who you are, regardless of what your body may look like after you have the baby. Let's get into details. Sometimes women get stretch marks. Sometimes women have swollen feet or their face. Anything that's not of the norm that you are as far as like appearance wise before, try not to lose yourself. Try not to lose yourself. Your appearance on the outside, you can't come into agreement with that. You have to remind yourself who you are as a person. And those are just temporary things. Don't let that attach your mindset. Try to remind yourself, it's not your fault that you feel this way. You are not alone, and it's okay to be vulnerable. Don't be ashamed to talk to someone, anyone, and try to get someone to listen to you. You're not a bad mom. It doesn't have to, you don't have to be doing it on your own. And if you get those thoughts that you're not giving the child the love that they need, it's false. It will get better, and just try to get some help. Don't be afraid.
Enjoy the season. You're in transition. Don't expect you to be the exact same person you were prior to childbirth, because you're not. Have a self-awareness that if you're feeling a certain way, to pause and ask yourself, why are you feeling this way? Does this make sense? Is this who I am? Is this the truth? Or is this just an overwhelming emotion that you are feeling? Enjoy the moment, because children grow so fast.
Okay, ladies. Also, I have something where it's the no-nos. If you have a friend, it could be your sister, your aunt, even your own mother, that's going through postpartum depression, these no-nos are like negative things that you don't say to a woman that has postpartum depression. Things not to say are, when I had a baby, I didn't have time to be depressed. You always wanted a baby, you should feel happy. You don't need medication. You know, this happens to everyone. Those are negative things that you should not say to a person that has postpartum depression. So be careful and be wiseful of what you say to a person that has postpartum depression. Because when you say negative things, it could just make things worse for them. You're just gonna make them feel worse than what they already are. And you know, women, that's the whole point of us being women, is always looking out for one another and uplifting and encouraging one another.
I agree. Everyone has different stages of life, and sometimes people have different experiences or, patterns of after they have children. So just try to say things that's going to encourage one another as women, and don't be so down or hard on a person that may be experiencing postpartum depression. I did want to leave off on a quote I found online. It says, "There will be so many times you feel like you've failed, but in the eyes, the heart, and the mind of the child, you are a superwoman."
So ladies,
Stay uncommon.